Juvederm Ultra Plus XC. Getting lip fillers soon. The doctor I have chosen uses Juvederm Ultra Plus XC. I'm reading a lot of comments stating that it is quite suitable for your lips, and a lot saying that it's too thick and has a higher risk of developing lumps. This is my first time getting lip fillers. Any thoughts, comments?
Thank you for your question. You're getting lip filler for the first time, and the doctor you have chosen is recommending Juvederm Ultra Plus XC, and you're getting some conflicting comments as to whether or not it's right or whether it might be too thick and at risk for creating lumps. Well, I think that certainly it's understandable to be a little confused about the best option in terms of the fillers that would be right for you, especially since it's the first time you're doing lip filler. Just a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and injectable fillers is a very big part of what we do in our practice, and lip enhancement is a very popular treatment in our practice. Particularly for people who are noticing the volume loss with facial aging. So when you think about your own lips, and since you didn't submit a photo, I'm going to ask you to just kind of look at your lips in the mirror or take a photo and look at the different elements. When we look at a lip for enhancement, I look at the following. I look at whether or not there are some lines around the lips. I look at the lip border. I look at the area called Cupid's bow. I look at the pillars. I look at the volume of the pink part of the lip. I look at the proportionality between the upper and lower lip. I look at the lines or the lines from the corner of the mouth. Essentially, there's both a gestalt and then from a doctor's point of view, you're looking at different elements of the lip. And customization of fillers is important. Now, generally, I find that it is my practice and experience to use a softer filler for people who are getting injectable fillers for their lips for the first time. And for that, I typically use a filler called Restylane. What I'm able to do with Restylane is not only add volume to the body of the lip, but I'm also to be able to place it at the superficial lines. I'm able to place it along the vermilion border. And I'm able to really sculpt the lips and be conservative and minimally traumatic. And the goal is, especially when you're trying this for the first time, is to really make this a positive experience. It's also important that they feel natural, that they look natural. And I think that it's important that you feel comfortable with the doctor. You know, we all have our go-to materials that we like using for what we do based on experience. So it might be your doctor's experience that Juvederm Ultra Plus XC is a material the doctor likes to place maybe at the deeper level of the lip so that the volume is more robust and that maybe so that the material lasts. You know, there is a spectrum of the filler offerings, whether it's from, in the Restylane family or the Juvederm family. And they all have different viscosities and different lengths of time that are generally perceived based on the FDA trials the companies went through to get their fillers approved. However, there's a wide spectrum also of the longevity of these fillers in the real world. That being said, I feel like because lips are sensitive and tend to swell, and there's a tendency to be very aware if there's a lump, I tend to go towards a more conservative and use a softer filler. This in no way is to disparage your doctor and the decision your doctor is making. But I think given that you've done this type of research, you should discuss this with your doctor and ask about this type of an option and really understand what you want to see improve after you're done with this first-time procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.